Before you open your heart and soul to somebody in the hope and expectation that they're going to help you, you need to make sure you've got the right person with you. What's your general approach to gender identity? What's your current experience with other patients like me? You need that help, and it needs to be the best help that you can get. Medical screening is really important. Trans men have a cervix. Trans women have a prostate gland, but we need to look after that prostate gland. But there are many trans women who are in stealth and their GP doesn't even know that they are trans. Breast screening, however difficult and painful it might be for you, is really important. And my biggest message to the world is, so when you're choosing your specialist, what we want to know is, where did you learn? Who did you learn from? And what qualifications do you have? So, did you actually have a formal qualification and teaching in this? Did you take an exam at the end of it? What was the result of the assessment of that exam? And that goes for doctors, counsellors, psychologists, surgeons, everybody. What's your current experience with other patients like me or other people like me? What's your feedback like? Have you got some feedback scores that you can show me? Have you got some 360 feedback from your appraisals that you could share with me? What's your general approach to gender identity? For example, how would you approach somebody who was struggling in their marriage with their gender identity? Why not test out some questions that may not actually apply to you to see what the general feel is? But because before you open your heart and soul to somebody in the hope and expectation that they're going to help you, you need to make sure you've got the right person with you, because you need that help, and it needs to be the best help that you can get. The age of the ability to give medical consent is always something that comes up. And my biggest message to the world is that the age isn't different if you're trans or not trans. The age at which you are able to give consent to your own medical treatment is set by two things. One is your level of maturity and ability to understand, and the other is sometimes set by your jurisdiction where you live. So some countries will say, if you are under this age, you are not allowed to give medical consent. You have to have someone to consent for you. And if that's the law, that's the law. In countries like the United Kingdom, that is not the law. And the law is that a child should have the ability to give consent to their medical treatment, as long as they are mature enough and they have the capacity to understand that treatment. And that means understanding the effects of that treatment and the effects of not having that treatment. Both of those are really important. So for some reason, I don't know, transgender healthcare seems to be different and there seems to be different rules. But during my time at Gender GP, I have always maintained that transgender young people should be treated exactly the same as cisgender young people. And that means that if a young person has the ability to give informed consent and has the capacity to understand the proposed medical intervention, the effects of having it, the effects of not having it, and they're able to retain those, they're able to discuss those with you, they're able to explain it back to you, then that young person has the capacity to give medical consent on their own. And if it's a bonus if they have a supportive parent with them as well. Blood tests are a whole discussion on their own. Do we need them at all? Should we have blood tests? How often should we have, and what should we measure? Rule number one in medicine is only do a blood test if you're going to act on the results of it. So really important that we know what we're looking for and what we're going to do with the result. So hormone levels, it's really important that we have enough hormones. And also, we don't want too much. Too much isn't good, too little isn't good. So we want to mimic the natural adult human hormone levels. And then some of the other medicines that we use, we might need to do some blood tests. For example, there's an anti-androgen, so an anti-testosterone called cyproterone, and that one we ought to keep an eye on the liver. Another anti-androgen called spironolactone, which stops testosterone working, and for that one we ought to keep an eye on the kidney function, on the potassium. But otherwise, this is extremely safe healthcare, and there's very little monitoring needed. And, if your doctor's suggesting that you need lots more blood tests, you can sometimes just say, well, what are you going to do with the results? What exactly are you checking for? What is the risk that we're looking for that's going to be picked up on that blood test? We don't want to over-pathologise being transgender. Sorry to interrupt. Thank you so much for being here. Thank you for listening. Thank you for watching this video. I notice that some of you don't actually subscribe, and it would really help me if you did subscribe, and it will also make sure that you can get my next video if you want to. So just click the button. Medical screening is really important, and we know that transgender people don't present themselves to screening services. So, for example, trans men have a cervix, and that cervix, it's really important to look after it and make sure that it doesn't have HPV, and make sure that if it does have any changes that might mean cervical cancer down the line, that we spot those early. So cervical cancer screening is really important for anybody with a cervix. Trans women have a prostate gland, and prostate glands play up sometimes. They're a pain in the... And we need to look after them, and we need to keep an eye on them, and we need to keep an eye if they're causing problems with bladder outflow. We need to make sure that they haven't got cancer growing in them. But there are many trans women who are in stealth, and their GP doesn't even know that they are trans, and they would have no idea that you had a prostate gland. But we need to look after that prostate gland. Breast tissue. Trans guys would much rather, many trans guys would much rather not acknowledge to the world at all that they had any tissue there. But that tissue, if it is there, we have to make sure that it doesn't get breast cancer allowing to grow in it. So breast screening, however difficult and painful it might be for you, is really important. And trans women, with your new breasts, you need to have screening. You need to think about having screening to look after them. And however difficult it might be for you to sit in a screening service full of women who may or may not accept your presence there, it's really important that you get screened. And so screening, and my message to doctors, nurses out there is, it doesn't matter what gender this person is. What matters is, what body parts do they have, and how do we need to look after them? And it takes me back to my sexual health days, where, we mustn't assume. We mustn't assume that because you're female, that your your partner is male, and that this is the kind of sex that you have. In the olden days, we used to assume that. We don't assume that anymore. We ask questions like, do you mind if I ask, is your partner male or female? Do you mind if I ask what kind of sex you have, so that I know where best to take the screening infections from? And the same for trans people. Do you mind if I ask, have you got any breast tissue? Have you got a prostate gland? Do you mind if I ask if you've got a cervix? And I can hear the critics out there waving their flags and getting all irate. It's true. Some men have a cervix, some women have breast tissue, some men have breast tissue, some women have a prostate gland, some men have a prostate gland, some men don't have a prostate gland. Doesn't matter. Let's just think about health and health prevention for all. And again, I always say it, that these are the questions we should be asking in research. These are the answers that we need. We need to move away from, is it okay to treat a trans person, to what is the best care ever to treat a trans person? Thanks for watching, thanks for listening, and don't forget that I write about this all day, every day on my website. Come and have a visit, I'll see you there. Link is below.